During this COVID pandemic, to what extent is the government responsible for prioritizing the protection of the healthcare workers compared to the general public?
I need to have the vaccination first, as I have more direct contact with people.
I'm also vulnerable, as I also have direct contact with people, especially when I'm working in consumer service sector.
I should be the one who takes the ventilator first, as I'm among the people who benefits the society the most.
Everyone's equal. As a taxpayer, I also have the right to use the ventilator. Occupation doesn't mean that you're prior to me.
The ethical principle of equality in the medical field means equal access for equal need. Therefore, vaccination should be prioritized to those with the greatest healthcare need, the elderly. They have a far higher severe disease or death rate from COVID infection comparing with the other age groups. Some of them might already have chronic illnesses or declining immune response, which are closely linked with COVID-related morbidity and mortality.
Frontline workers are at an increased risk of exposure to the infection with COVID-19 and of transmitting that infection to susceptible patients. Protecting them means protecting the health and social care service. This does not mean that the life of a health worker is more worthy, but that they have greater potential to play a vital instrumental role to the society. For instance, if all physicians and nurses are incapacitated, all patients, not just those with COVID-19, will suffer greater mortality and lower life expectancy. According to the UK Biobank, healthcare professionals were more than 7 times as likely to have severe infection compared to non-essential workers. And also, not all of them are young and healthy. For instance, the practice of asking the retired doctor to return back to work is already against the primary ethical principle to do no harm.
Even in times of COVID, government interventions could still be seen as a violation to basic human rights, such as forcefully isolating healthcare workers from their loved ones in aims of reducing transmission risk. Arguably, the government could provide a lot more resources for healthcare workers, but it is their responsibility to take care of their own health. For example, the New Delhi government said that although the Hospital Infection Control Committee is responsible for implementing control and preventive measures for COVID, the final responsibilities lay with the health workers to fully protect themselves.
As the healthcare system, such as the NHS, is funded through national taxation, the government has a social duty to protect the health of the population. As stated above, prior protection for the healthcare workers is actually the act of increasing protection for the majority of the population. So, it is the government's responsibility to implement this approach. Additionally, in order to distribute the protective equipment and vaccination to all the healthcare professionals in the country, individual involvement is not enough to make this happen. Therefore, it becomes clear that only the government can manage to supply all the equipment nationwide and provide the greatest support to the healthcare sector.
We conclude that the government should take account of the most responsibility to provide prior protection to the healthcare worker compared to the general population.
Large-scale distribution of medicine and protective equipment could only be managed by the government. And protective policies such as isolation could only be enforced by the power of the government to proceed effective response to this outbreak.
Giving healthcare workers priority for prevention and treatment, recognize their efforts of the high-risk work of saving others, and ensure the survival of the greatest number of individuals. As stated above, one healthy doctor can save a large group of ordinary people.